Thank you very much, Mr. President. Mr. President, I rise today as the chair of the Appropriations Committee to talk about several challenges facing our country. First, I just want to respond to the comments made by many of the senators this morning on the compelling need to pass a supplemental appropriations to help Israel replenish the rockets it's used up in its Iron Dome missile defense system. I am an unabashed, unrelenting supporter of that effort. For many years as a United States Senator, on the Appropriations Committee, on the Defense Subcommittee, and also as a member of the Intelligence Committee, I know how important the Israeli missile defense system is. Iron Dome, David Sling, others that were absolutely crucial. I worked hands-on with Senator Inouye, the late great senator, a Congressional Medal of Honor winner, to make sure we fund the missile defense system for Israel and to work on a bipartisan basis. Senator Stevens, Senator Cochran, we have been working together, and thank God it worked. And also to implement a bipartisan agreement signed by President Bush with the government of Israel that we would always help Israel maintain its qualitative edge. And you know what? We've done it, and I'm proud of it. And now more than ever, anti-missile defense system that has worked needs to continue operation. We know that the technology works, but they need to make sure that they have the tools to make the technology work, these additional rockets. We know that Israel is under attack. It's always been under attack since its very founding. This is not an existential threat. This is not an abstract threat. It is a daily threat. And we know that Israel is trying to defend itself against the grim, unrelenting attacks by Hamas, a self-avowed terrorist organization that has sworn in its documents not to allow Israel to continue. They absolutely oppose an independent Israeli state. Mr. President, it is this week that this month, that we're commemorating the Warsaw Uprising. The presiding officer is a member of a group we affectionately call the Polish Caucus. Those of us who have a relationship with the Polish government, one of our greatest supporters in the NATO alliance. We recall that 70 years ago, people were willing to fight back against the Nazis, rising out of the sewers of a Warsaw ghetto to be able to fight them off with sticks and stones and out-of-date weapons, to be able to work to liberate Poland from Nazi oppression. And miles away, in places like Dachau, Auschwitz, and others, there were the death camps. We're 1 year away from commemorating the liberation of the death camps. We know that as those people marched out of those death camps, they made their way into Palestine, which became the state of Israel. We were the first nation to recognize the necessary and rightful place for Israel to exist as an independent government and forever and a day the homeland for the Jewish people so that they would be safe from terrorism and what occurred. So I am for this whole Iron Dome supplemental, and we need to do it. But it cannot be the only thing that we put in the supplemental. We have neighbors right now hurting in our own country, our western states, with wildfires raging over hundreds of thousands of acres, land being depleted, local resources of first responders exhausted, local funds being worn down. We have to be able to respond to the western borders. And then there is the crisis at our border, and the crisis is at our border because of the crisis in Central America. So when we move on the supplemental, Let's look out for the great state of Israel. Let's look out for our neighbors who are facing wildfires, and let's look out for what is going on at our border. But, Mr. President, I came to the floor to, first of all, compliment Senator Sanders for the outstanding job he did working on a bipartisan basis to pass the Veterans Access, Choice, and Accountability Act of 2014. What a great job they did. Out of a scandal, a terrible scandal, affecting our veterans, where they had to stand in line simply to see a doctor in the very country that they fought to defend, now found that they had to defend themselves against VA bureaucracy and, in some places, duplicitous action. Well, the Sanders bill goes a long way, again, working on both sides of the aisle and both sides of the dome. Gosh, when we do this, this is why I wanted to be a senator. I know this is why many others wanted to be a senator. Coming here, working on concrete problems, shoulder to shoulder, bipartisan basis, hands across the aisle, hands across the dome, and they did it. They now, when this bill is passed, we will reduce the long wait times for veterans. We will increase doctors and nurses and specialty providers. It will allow veterans to see local providers if they've been on a wait list for an extended period of time or have to drive 40 miles to be able to get to a VA clinic. Boy, do I know that when I look at some of the rural areas. And we're going to pay for it with $10 billion in mandatory emergency funds. Mandatory emergency funds. That's the way to do it. The Sanders bill will go a long way in increasing personnel and also in expanding a number of clinics, 27 new clinics. So I think it's great. But, Mr. President, as important as that bill is, it's an important step, but it cannot be the only step that we take this week. Mr. President, I am so excited that shoulder to shoulder again, if we work together, we could do a trifecta for our veterans. We could pass the Veterans Access, Choice, and Accountability Act, new opportunities for health care where veterans don't have to stand in line. Also, we're going to vote today on Robert McDonald to give the VA a new secretary, a new CEO, new leadership, hopefully new energy, new vitality, and new ways of doing business, bringing the practical know-how of the private sector to meeting our mission. But those two, as important as they are, I also come as the chair of the Appropriations Committee to say, why don't we take a third step that really will do the job? Let's pass the VA Milcon appropriations bill so we can actually put next year's funding in the federal checkbook rather than just putting VA on autopilot. We can actually make a big difference with the new accountability expansion of care bill, but that'll take days, weeks, months to put in operation. Right this minute, we could pass the VA Milcon bill, as well as giving as well as giving new leadership. I come to here because I really do want to move the VA Milcon. Mr. President, the Appropriations Committee works through its subcommittees. And well, have I had two great subcommittee chairman and ranking on VA Milcon. Two outstanding senators, Senator Tim Johnson of South Dakota, Senator Mark Kirk of Illinois. They have worked so assiduously on coming up with a bill for funding our veterans for fiscal year 2015. And it is an outstanding bill. But when we look, but right now, we're out there in the wilderness. We've moved it through the subcommittee. We've moved it through the full committee. It passed unanimously. And we're out in the ethers, waiting to come to the floor. Johnson and Kirk, Mikulski, Shelby, we're like people with our nose pressed against the glass on the floor. We see it within our grasp, but we can't get through, and all we want to do is help the complete job that we're trying to undertake today. You know, as much as the bill will be that Senator Sanders worked on, that without the VA Milcon appropriations bill, the veterans will lack key tools to expand care. Important support personnel that allows the doctors and nurses to do their job, important technology to run contemporary institutions. And by the way, the bill that we're going to be working on, the Sanders bill, is focused on health care. But we on the Appropriations Committee dealt not only with aspects of that, but also the terrible backlog on veterans' disability. Mr. President, veterans' disability. Not only do you have to stand in line to get health care, but you're standing days, weeks, months to get your disability claim. You've lost an arm or a leg, or you can't breathe, or you have PSDT, and we can't get your disability processed. This is unacceptable. What we do in the VA bill is come up with the funds to really modernize the VA. First of all, just in terms of health care, to complement the Sanders bill, we have money in there to develop state-of-the-art technology so that the doctors can provide medical health care, to make sure that we have the modern equipment and the modern IT systems. Right now, we need to be able to have DOD talking to VA because veterans come from DOD, but we have an interoperable system. We work to fix this. We also deal with this backlog, and you have no idea, Mr. President. My state of Maryland and my office in Baltimore has not had a good track record. I vowed to my veterans that I would try to break that backlog. And you know what? Working together, we've been able to do this. In the fiscal 15 bill, we fund an appeals process. We train additional claims processors. We require the management at the benefit administration to deal with the backlog, working with the new administrator. We have not only great ideas, but we actually put the money in the federal checkbook. And Johnson Kirk did it. And you know how they did it? Yes, talking to the VA, reviewing tons of GAO and Inspector General reports. And guess what else they did, Mr. President? They talked to the veterans. They talked to these wonderful volunteer service organizations. So, Mr. President, I'm going to propose something later on today or later on this week. I don't want to be the chair of a committee that's got her face pressed up against the glass, looking longingly at the Senate floor with a bill I know will help the Veterans Administration with the heavy lifting to deal with the health care and disability backlog. I'm going to ask, and I'm just, because I believe in no surprises and no stunts. Later on today, or later on this week, I will ask unanimous consent to bring up the VA Milcon on third reading to be able to complement what we are doing here today. And I want to be able to do that, and I hope that no senator will object to it. Now, just again, in the spirit of full disclosure, because I truly have pledged to my colleagues on both sides of the aisle, I would never be a surprise chair, and I would never be one that pulls gimmicks or stumps. I'm going to ask that consent. I want people to know about it so they can discuss it, chew on it, talk at their respective their lunches. When I ask unanimous consent, I'm going to ask that it be brought up on third reader. Why am I doing that? Because under the rules of the Senate, if you bring up a bill on third reader, there's no amendments. So the question would be, Senator Mikulski, are you trying to stiff arm again? No, I'm trying to get the job done. I'm not trying to be stiff-arming the opportunity to offer amendments, but we have 72 hours left before we take this really long break. really long, very long, did I say long break. I don't think when you need health care for veterans, when you need to modernize technology, when you need to crack the backlog, while we're kind of basking in the sun somewhere, I don't want them in line. So either this afternoon or sometime tomorrow, I will ask unanimous consent, that I will turn to my 99 colleagues, and in the spirit of really meeting compelling needs of our veterans, I will ask that that bill come up so that as we move through the other two aspects that we're going to do to help veterans, we can do the VA Milcon bill. So, Mr. President, I'm going to come to the floor today to talk about how we support a treasured ally, how we look out for our neighbors in the West fighting our wildfires, and how we deal with the crisis in Central America, where children are being victimized and brutalized every day, so they're making a long march across that terrain and territory to come to the United States of America. So, Mr. President, I hope in the short time the Senate's going to be in session this week and this month, and even this year, that we could use this week to meet the needs that are confronting us. But most of all, I would hope that we do not just do part of the job for our veterans. We do this trifecta that I'm recommending, passing the Veterans Accountability Act and Health Care Act, give us a new CEO, and have a chance to pass the VA Milcon bill. Mr. President, I yield the floor.